What is a natural rhinoplasty? The term natural is a euphemistic word, and there's nothing truly natural about changing your nose. However, what goes on is many physicians change the nose in a way that makes the person look operated upon. And I can point out a few of them that are very specific. What my goal is to make you look like you were born with a beautiful nose. Not that I operated on you to get that. And there are some subtle differences that can make us look not operated upon, but still have a beautiful nose. What are the things that make rhinoplasties look operated upon? Number one, we take too much out of the bridge of the nose and the nose looks too scooped. It's over-resected. Number two, in making an attempt, we narrow it too much and it looks pinched. The tip doesn't just look narrow, it doesn't look like somebody born with a nice narrow tip. It looks like somebody that got it out of a basket and they did too much. They went for too much. Number three is in shortening the nose gets over-shortened and we're looking at the person's nostrils. And that's an unnatural appearance. And then the fourth one is a little more subtle, but I see it a lot with rhinoplasty surgeons that don't understand the operation. In attempting to narrow the tip, they take too much out. This scars up in the air, and there's a big gap between the columella and the alar rim. And that makes people look like this, sort of pulled up in the air too much, and we sort of look into their nostril again. That's a second reason we could look into their nostril. And patients don't look good with that look. What are the secrets to natural rhinoplasty? So the secrets to getting a natural appearance are to not overdo any of these things. Patients often think is you do subtle things. Actually, if you look at my rhinoplasties, and I would ask you to look at Dr. Jonathan Sykes at my Instagram, you'll see the changes are actually big. But if you look at the after picture by itself and realize that's all we have. We don't walk around with our before picture. We don't walk around saying, look at what I look like between then and now. If you look at the after alone, the people do not look like they've had an operation. Yet they have very pretty noses and their faces look better. Their eyes look better. Their mouth looks better. And that's really what you want a rhinoplasty to do. What patients always do when they come into my office is they bring me the most gorgeous patient and they like their nose. Of course they like their nose. They've got the eyes of a phenomenal model and a beautiful smile and beautiful teeth. Of course they like that. But really, it's not exactly the nose. What we want the nose to do is blend in with the other features so that we look at the smile and we look at the eyes and we look at the bone structure, which are the features that make us look attractive. How much does a natural rhinoplasty cost? To me, I only do one kind of rhinoplasty. It's to make people look natural, so I'm using the word in front of rhinoplasty, but to me, I do a rhinoplasty that makes them look much better, but not operated upon. That's what I would call natural. And for me, that costs about $15,000 in Beverly Hills, all in the anesthesiologist, the operating room, and my fees. There are lots of surgeons in Beverly Hills that charge a lot more, but I feel comfortable with this fee. And if I do a revision operation, it costs more because usually I have to get cartilage from somewhere else. But that's the charge for a primary first-time rhinoplasty. I look forward to seeing you and your nose and hearing what you want to achieve. And I think I can do that for you. So call me, email my office. We will be very responsive to you, and I'd love to see you. Thanks a lot.